If we're going to build a new model for illegal drugs that is actually responsive to evidence, we need to learn the lessons from alcohol and tobacco. And the language on here is your world to a ticket of sophistication and style. And she is using a drug that when used as directed will kill you. When we base our processes, our policies, and our laws on fantasy, we do not have very good outcomes for us as a whole society. We need evidence-based policies for drugs and alcohol and tobacco in our society. So that brings us to the place of the discussion of a regulated market for all currently illegal drugs. Let's go there. The foundation for the new model will be two things. It will be public health and human rights. It has advantages. It's global in its perspective and acceptance, and it has successfully empowered many marginalized groups and has a significant history in Canada as we support our own Charter of Rights and Freedoms. I don't mind saying that the human rights model has two weaknesses. First of all, it doesn't balance individual rights with individual responsibilities. And individuals need to be held accountable for their behavior, especially when we're talking about drugs. It also does not deal with health issues directly. That's why we need public health. Public health has advantages. It includes prevention, treatment, and education. It's accountable. It's goal-oriented. It specifies specific health approaches and interventions. It understands the issue of social cohesion. The connectedness of people in society has something to do with the health of all of our society. So the inclusion of people that are marginalized is absolutely woven into the public health theory. The weakness of public health is that it can be seen as too intrusive or controlling. That's why we need human rights. The health model brings the focus of population health, and the human rights model brings the user's perspective to the table. It is difficult to get the balance between public health and human rights. We need more public health with alcohol controls. We need more public health with tobacco controls. We need more human rights with medical marijuana program. Users were not included in the process when that program was developed by Health Canada. Our methadone programs are in need of more human rights. People on those programs can't travel. They get very locked into locations. That's a lack of human rights. So what public health tools could we actually use to regulate the market for currently illegal drugs? Tool number one for me is branding. If you allow branding to occur, marketing will occur. We've learned that lesson from tobacco. So what I have here, this is pre-branded pot. It's colorful, it's logoized, it's convenient, and it looks a whole lot like another product that we're only too familiar with. That would be a problem for us. The image on the right is non-branded cannabis. And it looks a whole lot like a medication. Very different images, and they take us to a different place in society. We can control the design of the packaging. We can control the amount per package, the formulation, and the concentration of the product. We can do huge warning labels. We can do registration and approval of products before they're allowed, and we can do package ingredient labeling. We would need to control the corporations. Corporations are legally required to meet the needs of their shareholders. Corporations are all about profit. If profit drives the new model, we have a problem. Health has to drive the new model, health and human rights. So we would need to do price control and profit control. We could have sales from government-run outlets only. Governments could be responsible for packaging. A percentage of the tax or profit could be allocated to prevention and treatment programs. I would suggest perhaps 100%. We could have a ban of public trading of stocks for companies that sell these products, so they wouldn't be able to come back to us and say, our shareholders tell us that we have to do this. We could prohibit advertising and marketing. We would need to be very thoughtful about the supplier, because right now suppliers range from whole communities in British Columbia to inner city gangs, to impoverished farmers in third world countries. And we would need to be very, very thoughtful about how we are going to include those folks in the new model. At the end of alcohol prohibition, the illegal alcohol suppliers participated in the new model and were allowed to become non-criminal. So we would need to work with that process to allow folks to exit the criminal lifestyle and start to participate in mainstream society. And we would also need to be very thoughtful about how we dealt with third world farmers. Quite honestly, the best argument for continuing drug prohibition that I've ever heard is that drug prohibition is the only counterbalancing force that prevents first world countries from completely sucking money out of third world countries, as it allows money to go back to those most impoverished countries on the planet. So we would have to be very thoughtful if we changed it in allowing third world farmers to be supported by this process. The organization that I'm aware of that does the best job of that is called Fair Trade. If I look at the actual regulatory techniques that we could use which would control who is allowed to purchase the drug, we could restrict based on degree of intoxication. We already do that. We have a liquor store policy in the province of British Columbia that says if you're really intoxicated, you can't buy alcohol. We could have proof of residency, and it could be by neighborhood, by city, by province, or quite frankly by the country. We could have use location restrictions. We already have that. It's called bars for beer and wine. It's called people that smoke out in alleyways in the rain. It's called our supervised injection site for heroin and cocaine. So where the drug can be consumed can be regulated. We could have required training prior to purchase. If you want to purchase a firearm legally in this province, you need to go through a weekend training course. Perhaps people would need to pass a test prior to purchase, where you demonstrate that you have certain knowledge. We could have required membership in a group prior to purchase. Any professional group, be it physicians, accountants, veterinarians, nurses, belong to a professional body that dictates the behavior of that profession. That process of shared responsibility is a tool of cohesion. When people are responsible for each other's behavior, they get bounded together more tightly. We could do the same with drug users. What we could say is, if you want to purchase the drug, you need to be a member of a drug users group, and that group is then partially responsible, not fully responsible, but partially responsible for the behavior of the members of the group. And that group would do peer outreach and training and best practice policies in exactly the same way we regulate and control professionals. We also know that there are other needs other than dependency. The need that I've talked about elsewhere in this program is that any Aboriginal group that has had access to hallucinogenic drugs in their flora around them since the beginning of time have used those drugs according to ancient religious and spiritual traditions. So perhaps proof of need would be defined as cultural need as well. Or perhaps an individual could put a stop purchase order on themselves where they'll be refused the product for a certain period of time. We already have that. If you are a gambler and you believe your gambling is out of control, you can have your photograph put up in the walls or the door of a gambling establishment, and you will be refused entry.